Now for immunity. There are different types of immunity. So first up is innate or natural immunity. It's so named because it's present at birth and does not have to be learned through exposure to an invader. Hence, it is natural immunity or a natural response to an allergen or invader. Now, adaptive acquired immunity is immunity that is acquired actively when a person is, key terms here, exposed to a foreign substance and the immune system responds. Now, passive acquired immunity is passive immunity when antibodies are transferred from one host to another. Now, both actively acquired and passively acquired immunity can be obtained by natural or artificial means. Now, another key term here is B-cell immunity, humoral immunity, also called antibody-mediated immunity. This consists of multiple components. Notably, antibodies called immunoglobulins are produced against a specific antigen. So B cells will differentiate into plasma B cells that can produce antibodies. The humoral immune system deals with antigens from pathogens that freely circulate throughout the bloodstream or outside the infected cell. So once again, be sure to write it down. Antibodies is another word for immunoglobulins. Now moving on to T-cell immunity. This type of white blood cell, also called T lymphocyte, is responsible for protecting the body from infection and may even help fight cancer. So be sure to write it down, lymphocytes. Okay, now for hypersensitive reactions. There are 4 main different types. So for type 1, this is an immediate hypersensitive reaction, basically a reaction within minutes. So IgE, immunoglobulin E, is a type of antibody that mediates the release of a histamine and other mediators from mast cells and basophils. It's basically an allergic response. And speaking of allergic reactions, for example, from food, dander, pollen, and the like. And a potential complication is anaphylaxis, huge patho test tip. Be sure to write this down. This is a supersized systemic allergic reaction that puffs up and inflames the whole body and eventually closes the airway. Very, very deadly. Now, the second type of reaction is the type 2 antibody-mediated immune reaction. For example, the term cytotoxic or cell toxin, a toxic substance or process which results in cell damage or cell death. So just let the name help you. Cyto means cell, and toxic means toxin. And a key term for this type of reaction is IgG, immunoglobulin G. This is a type of antibody that alerts the WBCs to kill a cell. So a great example for this is a blood transfusion reaction, like giving the wrong type of blood to the wrong patient. This will initiate a type 2 antibody-mediated immune reaction, where basically the WBCs kill the foreign invaders of red blood cells. Now, type 3 is the immune complex reaction. So immune complex, they can precipitate in various tissues such as skin, joints, vessels, or glomeruli, and even other organs, attracting more and more inflammation and WBCs to destroy the organs. So a great example here is an autoimmune disorders. So Hashimoto's with hypothyroidism, or RA, that rheumatoid arthritis, where the body attacks all the joints in the body. And SLE, systemic lupus erythematosus, and even glomerulonephritis caused by a strep infection that travels down to the kidneys, wreaking havoc. Now, the last type is type 4, a cell-mediated delayed hypersensitivity reaction. This is mediated by T cells rather than antibodies, which make it different than type 1 through 3. And a great example is a TB skin test, or a tuberculosis skin test, where a tuberculin reaction results from a small amount of tuberculin injected into the skin of a person previously exposed to tuberculosis. So mononuclear cells accumulate in the subcutaneous tissue along with the abundance of CD4 cells, leading to an induration and a redness, developing at its peak in about 24 to 72 hours. Fancy words for a reaction that shows a small red bump showing the client has been exposed to tuberculosis. All right, that wraps it up. Thank you so much. Anaphylactic shock or severe allergic reaction, like from a bee sting or even a peanut allergy. Again, anaphylactic shock, we have that severe allergic reaction. The key treatment to know for the NCLEX, and write this down, epinephrine or epi auto-injector. We have to know this and the key points, so let's play a segment from our pharmacology master course. For this lecture, we're talking about anaphylaxis, that severe allergic reaction. We give an EpiPen, or aka auto-injector, to inject straight into the outer thigh for an IM injection, typically after severe allergic reactions. For example, a bee sting or food allergies. Say we're eating shellfish with an allergy, the client goes into an anaphylactic shock, resulting in deadly hypotension and bronchoconstriction, which inevitably leads to death via cardiac and respiratory arrest. So the key points to know. Hesse mentions Epi is the first drug used for anaphylaxis. And ATI backs this up by saying, first signs of anaphylaxis reaction, those hives, dyspnea, and hypotension, we use an EpiPen. So the key term here to know is it's the first drug for the first sign of anaphylactic reaction. We always use Epi first. Now, 2 big NCLEX tips. We repeat every 5 to 15 minutes if the signs and symptoms continue. And we repeat Epi until the signs and symptoms resolve. So we keep on repeating Epi until those signs and symptoms go away. Then we give the other medications. And in the NCLEX world, we just keep on giving this drug forever until those symptoms resolve. Now, how do you know if it's a supersized anaphylactic reaction and not just a mild allergic reaction? Well, any allergy that affects the ABCs, the airway, breathing, and circulation, or even induces hives, this is deadly anaphylaxis, the supersized allergy reaction. So again, don't delay Epi injection. We inject immediately upon these signs and symptoms. And no skin prep is necessary. Just stab that outer thigh straight through the pants and hold it there for about 10 seconds. So the correct medication sequence is Epi first, then diphenhydramine, or basically Benadryl, and lastly albuterol and steroids. But out of all these, most question banks only stress about Epi being that first drug during anaphylaxis, and the rest only after the acute signs and symptoms have resolved. Remember, we repeat Epi as a priority until those signs and symptoms resolve. Now, Kaplan mentions a patient scenario, administration of ampicillin, and the client reports itchiness and difficulty breathing. The priority actions is number 1, stop the infusion that's causing the problem. Number 2, you assess by auscultating the lungs or listening to the lungs. And number 3, you prepare to administer epinephrine first. So again, not steroids, not albuterol, it's always Epi first. And secondly, the Kaplan mentions effective management of shock. You have a BP that's a little bit high, apical pulse that is 99, and a cap refill that's less than 2 seconds. Guys, this indicates good perfusion, meaning Epi is doing its job to press on the veins as a vasopressor. So it's pressing those vital signs up. And speaking of normal expected side effects to know after giving this medication, tachycardia, that heart rate over 100, palpitations, and dizziness. Again, these side effects means that Epi is doing its job to prevent that shock, or basically that death from low blood pressure. All right, that wraps it up. Thank you so much for watching. Now for neutropenic precautions. Again, neutropenia is the very low WBC count. This happens with chemo and radiation, where bone marrow is suppressed, which suppresses the production of RBCs. So let's play a segment from our chemotherapy pharmacology video. The big drugs to know for chemotherapy is doxorubicin and cisplatin. So before we get into this, just a little heads up. Don't let the NCLEX trick you with sound-alike drug names. Doxorubicin is not doxycycline.
So just think the O's in doxorubicin is for chemo, for oncology clients. And doxycycline is an antibiotic that we cycle on and cycle off for infections. Okay, now that that's cleared up, let's begin here. So chemo drugs are given to slow or stop the growth of tumors by directly inhibiting the growth of cells in the body. So the good news is that tumors, which are fast-growing cells, they stop growing and the cancer dies. But the bad news is that chemo is typically non-specific, so it kills all the fastest-growing cells in the body. Chemo is like an atomic bomb where no one is spared. So bone cells die, skin cells die, and hair follicles die, since these are some of the fastest-growing cells inside the body. Again, chemo is the nuke where everyone dies, the good guys and the bad guys, the healthy cells and even the cancer cells too. So that's why the main side effect we get from chemo is hair loss and weak skin. But most of all is the bone marrow suppression. This one is the biggest to know for the NCLEX and exit exams since it's the most deadly. So just think chemo is bad to the bone. So cue the music. So chemo says, I'm bad to the bone. I'm bad. Chemo's bad to the bone. Okay. So yes, it's bad for the bones, but why is it so deadly? Well, just think about the patho here and what the bone does. The bone marrow is responsible for making all the most important blood cells in the body to help protect us as well as give us perfusion and oxygenation. So when the bones get suppressed, we get suppressed blood and suppressed immune system. Low RBCs and low CBCs results in low blood volume, aka anemia. Normally between 4.5 to 6 million RBCs, but these will be decreased. We also get low platelets, normally between 150 to 400,000, which results in big bleeds. Remember, platelets less than 100,000 is called thrombocytopenia. So we teach patients to not use razor shaves, use electric shavers. No bearing down to poop, we use stool softeners. And no falls, we avoid rugs, and we use well-lit hallways. Now lastly, the most deadly of all here is the low WBCs called leukopenia, less than 4,000. Normally, white blood cells should be between 5,000 to 10,000. Now, WBCs are the police of the body, which I call the WBC Elite Squad. They clean up the streets, kick out infection, which are the criminals, and keep the body safe and free from infection here. But the atomic bomb of chemo that has been dropped kills almost all of these WBCs, which wipes out our defenses, making the body a deserted ghost town where infection can run wild, like the Wild Wild West. It's pretty sad. I miss the WBC Elite Squad. Now, this leads to low to no immune defenses, which is called immunodeficiency, and immunocompromised, which is very deadly, since any infection can kill the patient. So the big key term here is that fever is priority. And a key number to know for the NCLEX is any temperature over 100.3 Fahrenheit or 38 degrees Celsius. So just think, 38 is not great, since a low-grade fever can indicate a big-time infection. Now, that's the reason why we call it neutropenic precautions, or we use that reverse isolation. We're doing this to protect the patient. So, 2 big test tips to know is no fresh flowers and no fresh fruit. And we always avoid crowds and sick people who are immunocompromised. Typically, these 2 come up a lot on question banks, since they can be the most deadly. Now, Kaplan mentioned this, saying that doxorubicin temperature is highest priority over 100.5, or that 38 degrees Celsius. Yes, it's over 100.3, so it's very priority. So think doxorubicin, we get a ruby red body like a fever, and it's priority, guys. Fever is always priority with chemo drugs. Now, this drug also causes decreased insulin sensitivity. So clients end up with hyperglycemia, basically that high sugar. So the HESI mentions doxorubicin, monitor for hyperglycemia. Remember, Insulin helps sugar into the cell. So without insulin effectiveness, sugar is not going into the cell, and now it just hangs out in the bloodstream, causing high sugar. Now, 2 side notes for all chemo patients. Since, what we talked about before, the skin cells are very weak, we never use rectal thermometers to check body temperature, since it can lead to a perforated bowel in the lining of the rectum. Pretty crazy, right? Well, that's how sensitive the skin really is. And number 2, the nausea is a common side effect. So ATI mentions a patient scenario where the patient's in chemo and the child reports nausea and vomiting. So the priority nursing action is to stop the chemo, flush the line, and administer ondansetron, which is an anti-nausea medication, brand name Zofran. So for neutropenic precautions, Saunders mentions, the client receiving chemotherapy, the white blood cell count is extremely low, and places the client on neutropenic precautions. Which intervention are components of these type of precautions? Select all that apply. So look for the key terms here. Removing fresh cut flowers from the client's room, instructing the family members on proper technique of hand washing, and instructing the family members to wear a mask when entering the client's room. And Hesse mentions, a patient about to undergo chemotherapy, which expectation will the nurse have when providing care for this patient? The key term here is fresh flowers. They should be discouraged from the room of a patient with neutropenia. And Kaplan mentions, the nurse is planning care for a client with neutropenia due to chemotherapy. Which intervention should be included? Monitor the client's temperature every 4 hours. And a second question, the client who's receiving chemo, which of the following findings should the nurse identify as a priority? Report of a sore throat. Yes, we're looking for infection, so look for the key terms that prevent or monitor for infection. All right, that wraps it up. Thank you so much for watching. Lupus is our next topic, also called systemic lupus erythematosus, or simply SLE. Now, it's an autoimmune disorder where the body attacks itself, causing major inflammation in the connective tissues, like the skin, joints, kidneys, and the heart, resulting in major organ failure over time, typically seen in the kidneys first. Now, the bad news here is that there's currently no cure for lupus, but the good news is that we can identify and avoid triggers which causes flare-ups. So we want to avoid the S's of lupus here in terms of triggers. S for sun exposure or UV radiation. Huge NCLEX tip. Write this one down. Sun exposure and UV radiation were the most tested. S for smoking, S for stress like physical and emotional, and S for sepsis or infection. Like all autoimmune diseases where the body attacks itself, we want to avoid anything that can cause an irritant to the body, inducing an immune response. Now for the causes and risks. The cause of lupus is unknown, but it mostly happens to women 14 to 45 years of age. So estrogen hormones are thought to play a major part in lupus. As well as ethnicities play a part. Asian, Native American, and African have higher chances of lupus. And of course, UV radiation from the sun makes it worse. Now for the signs and symptoms. The top 3 to know for your exams and the NCLEX, I'd write these down. Number 1 is a butterfly-shaped rash on the cheeks and the nose. Huge NCLEX tip. Write that one down. Most tested sign for lupus is this butterfly-shaped rash, usually appearing after sun exposure. So the memory trick. For lupus, think a looping butterfly that loops around in a circle until it lands on your nose or the cheeks. Now, number 2 is a fever higher than 100 degrees Fahrenheit. We must report this to the HCP. Since clients are immunosuppressed, a slightly elevated temperature typically means a really big infection that can turn deadly. And last, the joints are painful and swollen, called arthritis. Now, these are the top 3 most tested signs for lupus. Now, as far as labs, think about the organ damage here. So the most damaging finding are typically the most tested findings. So write it down. Creatinine over 1.3 means bad kidney. Huge NCLEX tip. Typically, the kidneys are hit the hardest here. Next is decreased WBCs, normally between 5,000 to 10,000. So below 5,000 is normal for these patients. Typically, we see clients that are on immunosuppressants, and thus WBCs are lower as the immune system is suppressed. And lastly, inflammation all over the body here. So we see increased ESR, that erythrocyte sedimentation rate, as well as CRP will be increased, or C-reactive protein. Now, there's a lot of other various general signs and symptoms since the entire body's inflamed and getting attacked here. So we also see vasculitis, which is inflammation in the blood vessels, or inflammation around the heart, called pericarditis, and even ulcers in the mouth, brittle bones, and anemia. Now, it's so vague that a diagnosis is difficult. So we need 4 or more criteria to be met before a diagnosis can be made. But this is typically not tested on. Now, what is tested on is the client education. So remember, avoid the S's of lupus. So huge NCLEX tip here. S for sun exposure, as mentioned before, that UV light is the most tested, as well as smoking, stress that is physical and emotional, and even sepsis or infection. We always notify the HCP for a fever. So again, write these down, especially the bolded ones here. They came up a few times on Select All That Apply questions. Now for pharmacology, we can give steroids ending in zone, like prednisone. Steroids soothe the swollen joints and skin. But really the most tested is the immunosuppressants, which are given to help the body stop attacking itself. So we have hydroxychloroquine, methotrexate, infliximab, and azathioprine, brand name Immurand. Now, these are the need-to-knows. Exams and the NCLEX love to ask about these. So let's cover all the highly tested key points from our pharmacology master course. All right, that wraps it up. Thank you so much for watching.